Good afternoon, everyone, and thank you for joining today's webinar, Intimate Partner Violence in the Time of COVID-19, TANF's Vital Role in Prevention. We are very excited to have some expert presenters before you today to discuss this topic. I am James Butler, and I serve as one of the program specialists here in the Office of Family Assistance, Administration for Children and Families, under the leadership of Lisa Washington Thomas. Before we get started, I'd like to do a very brief review on how to use GoToWebinar. In your upper right corner of your screen is the control panel. You can minimize or enlarge the control panel by clicking on the orange arrow. By expanding the control panel, you can scroll to the bottom to type any questions you may have and provide responses to our polling questions. We strongly encourage you to enter your questions throughout the webinar and indicate which speaker you'd like to respond to your questions if it's for a specific speaker. We will monitor your questions and address them during our Q&A session. We will also launch several polls throughout the presentation, which you can respond to by clicking on the radio button next to your preferred response. And we will leave each poll open for about 30 seconds for your responses. Moving us through today's discussion will be Jessie Kendall, who serves as the Senior Manager at ICF. Jessie has over 17 years of experience in technical assistance and capacity building provision, writing, research, and information dissemination. She works on a broad spectrum of initiatives in anti-poverty programming, workforce, human trafficking, juvenile justice, and education systems. Prior to joining ICF, she served as a staff director at the American Bar Association's Center on Children and the Law, where she directed federal and grant-funded child welfare and juvenile justice reform projects, conducted legal research, and writing. She is also an experienced litigator, having for many years represented children in child protection proceedings. So I'll turn the floor over to Jessie. Welcome.
Thank you, James, and welcome everyone. Good morning or good afternoon, depending on where you're located. Next slide. So today's webinar, we're really going to have four primary sections. Think of this as sort of a four-act play. We're going to hear two brief presentations from Jan and Miriam, who you see on the screen, to introduce inter-partner violence in TANF, and that will be followed by a facilitated discussion with each of them. You're going to also see polls throughout today's session, and we encourage you to respond to those polls, and we'll be able to tally them in real time. And then at the end, we will have a time for you, the audience, to share your questions or feedback. If you do have a question throughout the presentation today, please feel free to enter those using the Q&A or the chat box. Today's webinar explores intimate partner violence among TANF recipients. Our two panelists will focus specifically on TANF strategies to strengthen support for survivors of IPV. The session will kick off, like I said before, with each of them providing short presentations that are really going to provide an overview of the prevalence of IPV among TANF recipients, as well as highlighting some of Colorado's work and strategies to support IPV survivors. We're then going to dive into that moderated discussion with a particular focus on the context that we all sit in today, with this sort of uncertain time and the effects the pandemic has specifically had on this topic. We are very fortunate today to have two fantastic presenters guiding our conversation. Miriam Durrani joined the National Resource Center on Domestic Violence in October 2018. She has a background working with victims of domestic violence with a focus on economic social safety nets, immigrants, faith-based communities, and limited English speakers. Her experience includes working at the national and state levels as the senior policy attorney at the National Network to End Domestic Violence, where she advocated for strengthening federal legislation to support domestic violence victims, and at the Virginia Poverty Law Center, where she assisted with management of the immigration clinic and state-level advocacy. She, too, has litigated family law and protective cases, particularly for victims of domestic violence and sexual assault in Virginia and in the district. She also worked at the House Judiciary Committee and is a certified mediator. Dr. Jan Mikush has been involved in violence prevention and intervention at the grassroots, academic, government, and policy levels for more than 30 years. She has worked at and consulted with a number of battered women's programs across the U.S. and was the executive director of the Colorado Domestic Violence Coalition for nearly 9 years. Dr. Mikush has also taught sociology, criminal justice, human resource management, public policy, and women's studies courses at universities all over the country. At the Colorado Department of Human Services, she has served as a coordinator of the Enhanced Domestic Violence Advocacy and Prevention Project, as a prevention specialist, and as the manager of Staff Development Section. She co-authored that state's Family Violence Option Rule and has been the facilitator for Colorado's FVO training for 7 years. Jan also co-authored and has co-facilitated the state's Coaching for Success training for county supervisors and managers all across the state. Quite an impressive group. Next slide. So here's our first poll question. We're hoping to get a little bit of information about who's in the proverbial virtual room. So please choose which of the following best describes your professional capacity or the types of services or work that you do. So you're a TANF or Human Services Administrator, a supervisor, a case manager, a research or TA provider, or perhaps other. And if you're other, please use the chat box to share what you do. Give folks a second to do that. Please select one. Okay, can we see the results? Aha, there it is. So it looks like we have a good mix of everyone, with quite a few in the other category. We've got about 20% of folks are in a leadership position at TANF or another human services organization. We've got a good number of supervisors, a lot of folks that are providing case management services, and many who are doing a lot of different types of work. So thank you. Next poll. So here we're going to start to focus a little bit on our topic today. By your assessment, has the prevalence of IPV or domestic violence increased during this pandemic? Yes, no, or I don't know. All right, let's see the results. It looks like a majority of you do think that the prevalence of IPV or DV has increased in these last several months, where a small portion if you don't, and a few aren't sure. And so we're going to be talking a bit about that momentarily. Next slide. Miriam, I'm going to turn things over to you to share a brief presentation.
Thank you. So my name is Miriam Durrani. I'm the Policy Director at the National Resource Center on Domestic Violence. Thanks so much for joining us today, and I'm super excited to talk about this with all of you. Next slide, please. This is a little bit about our mission and who we are. Just so you know, the National Resource Center on Domestic Violence is a primarily federally funded resource center. Our mission is also to provide resources, training, technical assistance. We're here for you. So if you ever have a presentation on intimate partner violence or domestic violence, feel free to send us a message and we can help you however we can. Next slide, please. So this is just a little bit, I wanted to highlight the special projects that we have. So we cover everything from domestic violence prevention to housing to awareness to research to community solutions. So those are a little bit about our projects. Next slide, please. So I know Jesse mentioned, we're going to talk a little bit about the prevalence of intimate partner violence. I'm assuming that most people on the call know what IPV is. When we say IPV, we typically mean abuse or aggression that occurs in a romantic relationship. So that could mean current or former partner. It could mean a dating partner, other romantic entanglement, variety of different relationships. But IPV can refer to a lot of different behaviors, from physical violence, sexual violence, psychological violence, to stalking. And we know that it is incredibly prevalent. It affects millions of people each year. The statistics that you see on the screen are directly from the CDC's own National Intimate Partner Survey, which we call NISVIS for short. So just wanted to flag in particular that millions of people each year affected by IPV. It also shows that the health and economic consequences of IPV are substantial. There's the risk of physical injury and death. There's the adverse health outcomes. There's also mental health consequences. And then there's other negative impacts like concern for someone's safety, missed days of school and work, needing related services related to IPV, and just I would say that all survivors, regardless of gender, report some variety of these negative impacts. Next slide, please. So the economic cost of IPV, I think I actually really like to share the statistic because it is kind of mind-boggling to me how much IPV costs to society. You can see the variations between men and women. Some of those reflect hospitalization costs, pregnancy costs. The costs to society are enormous. The cost for lost productivity, IPV injuries, loss of work, criminal justice, and other costs estimated to the US economy is $3.6 trillion. And that is also from a recent study. So I just think that number is mind-boggling, thinking about how we're going to dive into TANF in particular and how TANF can actually is an evidence-based way to reduce IPV and also an evidence-based way to reduce this economic cost to all of us. So next slide, please. So at this point, we know that recipients of TANF experience higher rates of domestic violence. At the time the family violence option was actually enacted, the estimates from the Government Accountability Office were about 15 to 51% of welfare recipients. So those numbers vary based on who was experiencing domestic violence at the time of their survey versus who had previously experienced domestic violence. The most recent survey was still a couple years ago. We haven't found a lot of incredible data that does a sweeping survey of TANF recipients. The numbers are more like 29 to 74%, which are enormous. And that's just a variety of reasons that we'll dive into, but that is much, much higher than the regular population. So I think for all the folks who are directly TANF involved on this webinar or who are going to listen to this webinar later, just know that it is much more likely than not that your client will have likely experienced IPV in their past or is currently experiencing it. Next slide, please. So we know that domestic violence and sexual assault occur across the socioeconomic spectrum. That's no secret. There are just unique challenges at this intersection. We know that significant numbers of low-income individuals are abused or assaulted, but the violence perpetrated against them can often make it impossible to climb out of poverty, and their partners are doing things like actively sabotaging economic independence, stability, they're limiting access to financial resources, they may be interfering with employment, ruining credit scores. Abuse and may also result in someone who is considered even median to high income being considered low income related to aspects of their abuse. And also choosing to end a relationship can also mean that survivor is losing access to maybe their partner's income, but also the house that they lived in, access to safe and stable housing. Their employment could be in jeopardy, their healthcare could be in jeopardy, and childcare could be in jeopardy. So lots of different ways to think about abuse that I don't feel like we necessarily always talk about, because we just often think about the physical violence, maybe even psychological violence, and how to get a survivor out of that situation, not really taking the time to think about all of these really complicated aspects of things like the out-of-pocket costs while navigating medical, mental health, relocation services, all of that. And even survivors that choose to pursue legal remedies, those are incredibly costly and take a lot of time. And I also just wanted to be clear that it's also reported in the NISVIS study, but survivors from communities of color, Indigenous survivors, those from other underserved communities, including immigrants, individuals with disabilities, LGBTQ individuals, even survivors who live in rural areas and things like that, are going to be disproportionately impacted by the effects of IPV and also experience IPV at disproportionate rates. And those issues are exacerbated and compounded by their vulnerability. So I also have a few stats up on the screen for you to dive into the specifics. So next slide, please. So a couple of years ago, we partnered with a few organizations. One that I would say is incredibly valuable is the National Domestic Violence Hotline, and we produced this report called We Would Have to Stay. So this surveyed survivors over a time period, and we got some incredible data on just why survivors make the decisions that they do. So 2/3 of survivors surveyed said that they stayed longer than they wanted or returned to an abusive relationship because of financial concerns. So not being able to pay the bills, afford their mortgage, couldn't feed their family. And 37% of them said that they stayed longer or returned to an abusive relationship because they were worried about being able to meet their own or their children's medical needs without the partner's insurance or financial help. And I would also flag, because childcare and children does come up very often in the TANF space, survivors with children were significantly more likely to stay or return because of the financial risk concerns related to child rearing, child caring, and all the expenses that come with children. And then there is another really fantastic study that was conducted by IWPR that said 73% of respondents said that their abusers took money from them against their will over the course of a relationship. 82% of respondents said that the abuser damaged, destroyed, or took their personal property, and 59% of them said that their abusive partner harmed their credit score. So I mentioned those aspects of economic abuse earlier, but I also just wanted to flag how widespread they are, because I think when you dive into the numbers, it's kind of shocking, and I feel like it's much larger than you would anticipate. Next slide, please. So since we're a resource center, we keep producing studies and research so we can provide you with the most up-to-date information. This is another report that we did in tandem with the We Would Have to Stay report. The difference between surviving and not surviving report, the title actually really stands out for me because respondents to this survey actually identified the array of public benefits, one of those being TANF, as literally the difference between survival for them and the difference between not surviving. So for survivors who had limited access to public benefits, it felt like their survival was in jeopardy to them. They lost homes, they didn't have access to basic needs, food, things like that. So despite TANF being very clearly identified in this report as a vital resource for victims, respondents described really varying levels of access. And I just wanted to share that they said less than half of the respondents reported that domestic violence survivors were actually able to access TANF when they needed it. And it was even fewer for survivors of sexual assault. Next slide, please. So a significant number of respondents shared that many components of the TANF system do not work well for them. That includes access to childcare, the amount of benefits paid, child support enforcement felt really confusing, the job education and employment services aspect of TANF. And then something that I think is incredibly important to flag is we know how vital the family violence option is for survivors, but many respondents also indicated the aspects of the family violence option do not work well for them. In particular, they identified even just notification about the existence of the family violence option, screening for domestic violence and sexual assault, and specifically the exemptions from work and other requirements due to their violence, the violence perpetrated against them, and the exemptions from child support. Respondents also described having a lot of problems responding to or just accessing the documentation that TANF offices require, like using a restraining order or a police report rather than a letter from a victim service provider. We know that now more than ever, survivors are not accessing the courts, they're not necessarily getting a restraining order, they may not necessarily have a traditional document that's going to prove their eligibility for the family violence option. Next slide, please. So I also just wanted to point out, I am leaning on a lot of CDC resources for this because they are fantastic and they have really helped bolster the point of economic security. So they created this fantastic toolkit called Preventing IPV Across the Lifespan, and it just highlights that evidence suggests that poverty, financial stress, and low-income households have an increased risk of IPV. Improving financial stability and autonomy can reduce financial dependence on a potential perpetrator and also provide alternatives to unhealthy relationships. If people don't have the financial resources to go somewhere else, they're going to be very unlikely to leave. And it actually highlights TANF as an example of a program that is an evidence-based way to strengthen household financial security and thus reduce IPV. So next slide, please. So just thinking back to the poll at the very beginning of this presentation and this webinar, we are hearing reports of intimate partner violence really skyrocketing across the country. I've showed some examples from a variety of different states. There are reports from CNN saying that, you know, at least 9 to 10 metropolitan urban police departments with high populations saw spikes or double-digit percentages of domestic violence cases in March compared to the numbers of March the previous year. There was 75 of the 76 YWCAs, which are domestic violence right around the country, said that they had a 69% increase in demand for services. And something else that's happening in tandem to this, which is equally horrifying, is that some programs are hearing crickets from either clients that they've worked with in the past or their support groups or members who they might engage with. So that means that survivors are potentially quarantining or trapped with an abusive partner or perpetrator, and they have no access to a safe way to access assistance, whether it's literally calling an advocate, whether it's texting. Those opportunities are incredibly limited in the efforts to social distance, to maintain, you know, any sort of semblance of staying at home. It gets really challenging for survivors to stay safe. Next slide, please. So this graphic is from a recent report from the National Domestic Violence Hotline, which just chronicled the overall national increase. They had about a 10% increase in their calls, but most of their contacts, when they contacted them since the pandemic, actually referenced COVID to some degree in terms of what was happening. So stay-at-home orders intended to protect the public, prevent widespread infection, is leaving the IPV survivors trapped with their abusers. Like I mentioned, seeking services is incredibly challenging. And now economic independence, which is a critical factor in violence prevention and also leaving an abuser partner, is being exacerbated because people are losing their jobs, they don't have access to the same financial security. Even those folks that have access to a job may have limited hours, they may have limited transportation. And the closure of schools and childcare facilities have added stress at home. and there's a literal limited ability to access law enforcement and courts for protective orders. Next slide, please. So one thing that I did want to flag is from both of the reports that we produced, I thought this was a really interesting statistic, well, all of these, on the way that domestic violence advocates and programs around the country are actually collaborating with their TANF offices. So the study only reported that about 1/5 of advocates were working with their TANF administrative agency. And that's a really low number when in the report, it also indicated that about 75% of individuals who were applying for TANF needed some sort of advocate to actually assist them with understanding TANF, understanding the requirements, and even filing the paperwork. So, and then about half of them reported that they worked with a TANF office on a case-by-case specific basis. So it's really valuable, this partnership, the way that this collaboration can offer benefits to both advocates, to both the TANF administrators. It's just a way to ensure that more survivors can get the services that they need in a way that they need and actually understand what's going on. Next slide, please. So thank you for bearing with me. I raced through all that important information because I wanted you to have it all. Thank you for your patience with me. And here are a few ways to reach us in case you're trying to get in touch with the National Resource Center. And I'm very much looking forward to diving into the questions so we can get into some more of the details. But back to you, Jessie. Thanks.
Thank you, Miriam. That was as you said, a chock full of information presentation. And just to remind folks, you'll see a little handout bar on the right side of your screen, and these slides, as well as some resource lists, are also available for you to review after the session. Next slide. It's that time again. We're going to be doing another poll. So what do you see as the primary challenges that have emerged or increased during the pandemic related to IPV? So you can select all that you think apply. Increased prevalence of IPV among TANF recipients, increased family financial instability, lack of privacy to access needed IPV supports, increased family stressors, or other. And if you want to put other, please put that in the chat box or the Q&A box. Give people another second for this one. All right, let's see what folks thought. Well, it looks like folks thought that all of these apply in some way. That during this pandemic, we're seeing an increase in the prevalence of IPV that, and maybe related to that or because of that, we're seeing instability in terms of finances, family stressors, and certainly there's a lack of privacy that might affect one's ability to even access IPV support. Thank you. Next slide. So now I'm going to turn it over to Dr. Jan Mikish to share some of the work that they've been doing in Colorado with respect to IPV. Jan? Jan, I can't hear you. You might be on mute. I'm not sure if others are having that same issue.
Sorry, forgot to unmute.
There you are.
So I wanted to say thank you for inviting me here today, and welcome to others for joining this very important webinar. And I am going to talk some about TANF and specifically related to how it relates to IPV. But and run through very quickly, I noted that 24% of the people attending are not in one of the TANF groups that were listed. So we'll cover a little bit of TANF, and if you want me to cover more, I can. but just as a general refresher. So could we go to the first slide, please? So as we know, TANF has 4 purposes, and that children are to be cared for in their own homes or in the homes of relatives to prevent or reduce out-of-wedlock pregnancies, job preparation, work and marriage, and promotion of 2-parent families. And I think it's really important. What is the purpose of TANF? And where does it fit in the puzzle in addressing IPV? We know that it is not a single solution, but it is part of a puzzle. So thinking, given the purposes of TANF, how can TANF be leveraged in our communities to reduce IPV? Next slide, please. So TANF provides cash assistance. It provides supports for employment and works with community agencies. And so the frontline case managers, eligibility technicians, case managers determine who is eligible for the cash assistance and other supports, as well as, and then the case manager works with the customer to help them develop an individualized plan that will lead to economic security for them, and then the administration typically works with other community agencies to increase the base of support for customers. Next slide, please. As you know, it's a block grant from the federal government, so it's federally supervised and state administered. That means that states within certain bounds can do a variety of things with their funding, and it's important to think about that. If we're talking about working with community agencies, what agencies are best equipped to deal with what aspects of domestic violence? And in terms of state administered, within the states, often counties then also have discretion about how they use the funds within a variety of boundaries. So a county in California maybe use their funds differently than a county in Maine because of the population with whom they deal, as well as the nature and extent of the intimate partner violence and the resources in that county, or excuse me, in that state and in the county. Next slide, please. So in Colorado, we focus on case management as individual, strength-based, family-centered, and employment-focused. Next slide, please. So several things that we do in order to ensure that our client, and these supports for the customers are for all customers, but a high tide floats all boats. So thinking about what are the fundamental things that we provide to customers that can be leveraged for survivors. So the income tax credit is not considered when we're talking about income eligibility. And that is because it is considered a reimbursement. So in some other cases, the income may put someone out of eligibility for TANF, but in our case, we do not count that toward eligibility. In Colorado, we have 100% pass-through for child support. So some of the considerations here are, in some states, and in Colorado prior to about 3 years ago, the administration of child support took some of the money out. If a non-custodial parent paid $50 a month, then the Child Support Services would take a piece of that for administrative services. We do not do that anymore. Now that 100% passes through to the custodial parent, and that's up to $500 a month that you can pass through. Above that, it will affect the status, the eligibility status of the recipient. So, as Miriam has pointed out, some survivors will return to the perpetrators or not leave the perpetrator if because of their financial situation. And this is a way we have passed through millions of dollars to custodial parents. Transitional food. After the customer leaves Colorado Works, which is our TANF, leaves Colorado Works, they still can receive food assistance for up to 6 months. So that cliff effect is mediated. In addition, they can receive child care for up to 12 months after they leave, so that they feel supported in a variety of ways and can transition more easily. And of course, we have the address confidentiality program that is, we're collaborating with that program with all of our customers. Next slide, please. So some of the regular collaboration support. And again, thinking how this can be used with survivors of domestic violence. So non-custodial parent services. In Colorado, a non-custodial parent can be contacted, someone who is not on the assistance can be contacted and provided services. Part of that is so that they can pay child support if that's appropriate. And part of it is to increase parenting services, as well as, and I may be jumping ahead of myself a little bit here, but if that person needs perpetrator treatment, we can pay for perpetrator treatment. And again, going back up and stopping the domestic violence before it impacts the survivor more, the survivor and the family more. So we can contact those non-custodial parents. Then the additional financial assistance to the survivor in terms of payments for a variety of things, bicycles, glasses, dental work, surgeries, cosmetic surgeries, etc. And then behavioral health services. And again, if the family unit is together, we can pay for behavioral health services, not only for the survivor, but for the perpetrator. And in Colorado, we have the Domestic Violence Offender Management Board, which provides certification for people who are highly trained in working with perpetrators of domestic violence. And they also have victim advocates attached to each one of those perpetrator treatment providers. And so we suggest that if there are behavioral health services that are provided for perpetrators of domestic violence, that they go through the list of people in the Domestic Violence Offender Management Board. So so it is safe, and it is evidence-based treatment. In terms of relocation assistance, we often provide that to not only people who are seeking jobs in other places, but also to survivors of domestic violence, and can be relocated in a variety of locations, in some cases in other countries, and in most likely within the United States. And then, of course, employment support in terms of uniforms, books, and other equipment. And of course, education and training, and education both for the children, so if children need special services, provide that, as well as training, on-the-job training, and other trainings that speak directly to the acquisition and retention of jobs. And then, of course, diversion and referrals to appropriate agencies within the community. And those, we emphasize that they build relationships with those entities. And just as a kind of an aside, I used to be the coordinator of the co-location project, in which the state contracted with local domestic violence programs, and so the responsibility lay with the program, and the program then was to collaborate with the local Department of Human Services, so that they decided how they were going to collaborate. And one of the fundamental was that they taught each other, that one entity was not going in to tell the other what to do or how to, they educated each other and then decided what that co-location was going to look like. So in some cases, the shelter was basically next door to, in rural areas, next door to the department. In other cases, like in Denver, the advocate was on site. In Mesa County, on site. Pueblo, on site. So that if there was a situation that arose related to domestic violence, the worker could either pick up the phone and call, and that person could be there in a matter of minutes, or could walk somebody down to the office of the victim advocate, or a variety of things. They worked it out together. But what we found in the evaluation of that is that both entities said, boy, did I learn a lot, that we don't know how we ever got along without this, that we learned the realities of the other so that we could really leverage those resources to serve our customers better. Next slide, please. So as Miriam pointed out, there is a high prevalence of domestic violence survivors, or a high number of domestic violence survivors who use TANF services. And it's really interesting that, as she pointed out, and I wrote down some of the data here, that 50% or more of survivors say they can't access TANF for a variety of reasons, a lot of logistical reasons. It's really interesting that even so, we still have 74% of our participants who are survivors of domestic violence. That's just amazing that those two that look like contradictory, but are very affirming that TANF services are absolutely essential to survivors of domestic violence. And as she pointed out also, that there are physical and behavioral health issues, job insecurity, homelessness, and financial issues that attach when there is domestic violence. So I won't be redundant on that. So next slide, please. So what do? So we provide screening, and so we provide screening for domestic violence. And one of the things that Miriam pointed out was that about the offering of waivers. So when there's a screening, and we have a state form that we use, and I do the training. I do the state training and have for about 7 years. So one of the things that we emphasize is when we're doing the screening is that it may not be appropriate for the client to even know you're doing the screening. There's no reason why that client needs to know that. You can hand them the screening tool. And of course, now that we are doing a lot of the screening on the phone rather than person to person, things have shifted. And so this is one of the barriers. How do we make that shift and ensure that we have confidentiality when we are doing the screening? So doing the screening in a way that is appropriate to your county and your state. Then the assessment. Now here is the key here. We in Colorado, we do an 8-hour training for the TANF workers, 8-hour training. And that's because you can't do an assessment if you don't know what you're assessing. That it's not just a matter of checking a box. It is really working with this person to understand whether they qualify for the waiver and which waiver would they qualify for, because we have the 3 waivers. So at eligibility, you're doing a screening and assessment for child support, because child support is a requirement of TANF. So, and if you cannot do a confidential screening at an assessment at eligibility because the perpetrator there, or you can't have privacy, you can't get the information, then what we say is put pending in our database and then ask the coach, the caseworker to do it. Because at that stage, there's also confidentiality required, and you may be able to engage them more. So one of the considerations, though, is if you put pending and you don't have the child support, and that person needs that child support, what you've just done is cut off that money. And so this is not something to be taken lightly. You think about what is the context, and ensure confidentiality and safety, number one, and then we work to determine what's best. So it's better to ensure safety and confidentiality and perhaps cut off some of the funds to the survivor so that at least they're safe. They may have money, but if they're not safe, it doesn't matter. So safety first and confidentiality. So then we do not, one of the things Miriam was talking about too is that in some states there is a requirement for some corroboration and documentation. We don't over-verify. The reason we do the 8-hour training is so that the worker or the assigned person can make the judgment, can decide how to do this. And we use the prudent person principle. And what prudent person is, that a person who is trained and understands can make a judgment and using client statement. And does the case statement run true? Does that work? And if there's a question, then take a breath and press pending, and pending whether you're going to grant good cause or not. Think about it, talk with other people, make the assessment, because you can't unring the bell. Once you have put that person in jeopardy, you're not going to unring that bell. So it's better to be safe and to say pending, let's think about it, or to grant it. You can always take it back when you have more information, but to grant that and then have the conversation. And then there are a number of other things. I'm not going to go into detail on those, but then provide appropriate referrals, and that is you should already have a relationship with your domestic violence service provider, as well as legal options within your community. And then, of course, the staff training, not only the 8-hour training, but also ongoing training with your local domestic violence program, as well as other service providers in your area. And then I want to reiterate that TANF can pay for perpetrator treatment and survivor treatment. And we try, and one of the things we emphasize is don't call it counseling, don't call it treatment, call it something else, because the perpetrator will have told that survivor that you're crazy, you don't understand, a lot of gaslighting. And so what we are advocating is working with your community to call it something like family empowerment or something like work leadership or something else, and not call it counseling, so that you are not part of the perpetrator's weapon and inadvertently part of the perpetrator's weapon. And in terms of children, a couple of things related to them, just generally, perhaps counseling and some kind of treatment. In addition, that it is not uncommon for a survivor to come in with a new wonderful partner, and the child, though, has seen domestic violence and is now starting to act out. And so some perpetrator treatment providers in Colorado and at other locations will work with children and adolescents, as well as the domestic violence service providers can work with children and adolescents. So I encourage you to think about how to leverage those resources for children and perpetrators and survivors. What we know also about perpetrators is many do not want to be behaving that way. They don't want to be doing it. They don't know how to stop. And there's not really that impetus to stop. And if we can provide just one more straw towards the impetus to stop that behavior and choose different behavior, that would be awesome. And so next slide. So just what we've seen, I've called around to domestic violence service providers in Colorado, as well as to the county departments of human services. And what we see is, as I think Miriam's data showed, that some of just absolute crickets for the first week, the domestic violence programs heard nothing. And so they did outreach and have now done and have worked with, collaborated with county departments of human services. This has brought them closer together, and they are they are creating innovations in order to address this, the changing nature and extent of the domestic violence. Additionally, what we want is that people stay on TANF as long as they can, that it's appropriate. So increase creativity around work activities, listening to people more about what work activities you're doing, and that includes things like, are you working with are you sharing time with other children? Are you doing shared daycare? Are you doing those kinds of things? So we can count that so they stay on TANF, and we can provide that base. And then our domestic violence program at the state that administers the FIPSA funds applied for the CARES Act money and received $900,000 that we have passed through to to local domestic violence programs. And I think my time's up. So next slide, if there is one. I'm not sure if there's a next. Oh yeah, just briefly, very quickly. So what I did was I looked at, thanks to county, state staff, I looked at, so were there increase in the number of waivers, and these are work waivers, that were provided to survivors of domestic violence. And we see, and these are months, so January, February, March, April, May. And you see that May went up to almost 15% increase. But remember, our base rate is about 300 to 400 waivers. So a small number of, and this is 50 people. This 15% is 50 people. So, and we have experienced several thousand more applications. So what I'm saying is we don't know, because people are, the workers are moving from their office to their home. They're trying to get people in the door. They're trying to get people processed, etc. So this is, just take this with a grain of salt or a block of salt about whether this is really increased or not. We don't know. I'm providing you with the data we have, and whether entering this data is a priority for workers who are just trying to maintain, don't know, but this is what we have. And then the next slide is just the actual numbers. And I don't think that's, you know, it really doesn't mean that much. So, okay, that's it.
Thank you, Jan. And just as a reminder again, Jan's slides, as well as all the slides, are in the handout pod for folks to use if you'd like to share these with your staff, or to download them for future use. So for the next, I'd say 15 to 20 minutes tops, we're gonna do a facilitated discussion with both Jan and Miriam, and then we'll move into some of the audience questions. And I've seen there's already been quite a few. I would welcome you, as some of the information Jan just shared is fresh, so please feel free to jot down any additional questions that you have for her as well. Miriam, I wanted to start with you. You spoke a little bit about how TANF is an evidence-based way to reduce IPV. Can you share a bit more about really how and why you see TANF as being such an important resource for survivors?
Yeah, absolutely. I just, going back to a report, thinking about the difference between not surviving and not surviving, I think something like 85 to 90% of respondents said that TANF was a critical resource for survivors of domestic violence. And most of them just said it's to help survivors address basic needs and establish safety and stability. So I think actually now more than ever, and I feel like COVID has actually helped show this fact, is survivors are typically very savvy and very understanding of what they need to help them achieve safety and stability. And I think we've seen the rise of this with just like flexible cash grants and even flex funding when it comes to housing. There are models where programs are working with like what survivors need to stay housed. So I think that means that survivors know whether they need a car repair that's going to help them have a working car to get to their job. That means they know if they can get a new fridge, it means they can keep and safely store food for their family. So having flexible cash assistance, I think, is incredibly valuable for survivors to help them meet whatever need that they know that they need to stay safe. And I think that's why TANF is so valuable and so important. And I think that advocates, survivors, you know, everyone knows that TANF is incredibly valuable. So it's just navigating how to access it and how to keep it.
So you both shared a bit though about this sort of disconnect though between the access and the need. And so can you tell me again, or expand upon what you see as sort of that, really the most primary barriers that survivors might be facing and even accessing TANF to begin with? And how do we suggest to folks on the line we overcome those barriers?
So something that I think it was interesting to me as it has come up as one of the primary concerns on our end in terms of our research is childcare and access to childcare. A lot of folks, you know, they want to participate in a TANF in-person orientation. They don't have someone to take care of their children. If there is a reimbursement available for children for their childcare, it's later. They don't have the financial resources to manage all of that in advance. We heard just the overall amount of TANF. You know, I know that there are, of course, limitations with that, but I think people realize that they may need a little bit more financial resources to achieve whatever they need to stay safe. And then We've also heard child support enforcement. I think for survivors who need child support, it's incredibly valuable, but for others, child support also may be putting themselves at risk of retaliation from their perpetrator. It could mean putting themselves at danger. It could mean breach of confidentiality if someone can access their address. And then, of course, just the intricacies of the family violence option. I think that a lot of people don't realize the exemptions that are available and how to navigate that. And I think that what I would highlight for everyone on this webinar is, of course, survivors are dealing with a lot of different things and you're balancing all this, but they're also just coming to you in a bubble of trauma, and that's going to affect them in so many different ways. So even if you are really thoughtful about how you explain things, even if you're really compassionate, of course, doing the best that you can, it doesn't necessarily mean that all that's getting processed and all that's really happening in an efficient, thoughtful way. But I'm sure Jan also has great examples of what barriers have come up in Colorado.
And I would echo that. And just thinking about all the logistics, first of all, you have to know that TANF exists and that it is, and then once you get there, you learn that it is a work program. It is not a program that is just going to give you money, that we consider it a scholarship program, that here is money so that you can become safe and supported to achieve economic security. And you're not going to stay on forever. So, and then there are all of these rules and regulations and requirements that people are going to have to meet. And sometimes people just say, for the $400 a month, that's not going to make me, I can't survive on that anyway. So why would I want to do all this? And not see it, and my needs are more immediate and my safety is more concerning to me than this receiving this $400 a month. And I'm just using that as a general, approximately $400 a month. That's not going to really work for me anyway. So even though we have a lot of support systems, yeah, but anyway, go ahead. Sorry.
No, I was just going to say, you gave a lot of really great practical advice in your remarks before, and I'm wondering if you could just share a little bit about what do you see, based on your expertise, as the role TANF should be playing in preventing and addressing IPV? Like, what are your suggestions to folks on the line with respect to what their role should be?
Community partner, that we all have the parameters within which we're required to work, and really being clear about what my role is, what the TANF role is, and what other people's roles are, and fit those together and leverage those in a wraparound. What are the needs of domestic violence, of IPV survivors? And then how can the community do wraparound so that they're not going to fall between the cracks and are really going to be supported? And part of that is, working directly with the families. Part of that is working to increase the messages that violence is not appropriate, and to work with perpetrators to stop, because unless we go back up and turn off that faucet, we're going to be under Niagara Falls with our tin cup trying to pull people out forever. And so what is the role of perpetrator treatment providers, of the legal system, of medical, of clergy, etc., and how do we fit in that so that we can prevent domestic violence as well as support the survivors and help the perpetrators stop their behavior.
I would just also add, Jesse, to Jan's point about partnerships. I think that partnerships can sometimes feel like, a full-time extra job. And I'm not a TANF administrator, like I'm not in your roles for those of you on this webinar who have to do this. but having it integrated into the training, into the work that you do, understanding the aspects and intricacies of intimate partner violence, I think just helps benefit everyone, and then helps also create much stronger, deep and meaningful connections and collaborations in the community. And I think that's something that is just challenging with working with survivors in general. And I feel like we as domestic violence advocates and service providers know this, but like no one's going to be the perfect victim, right? You're going to deal with them going back and forth to their perpetrator. You're going to probably deal with a very unstable job history. You're probably going to deal with mental health crises. There's going to be all these things that come up for you. And as someone that is working with your client administering TANF, that's probably going to be incredibly challenging. But the more I feel like collaboration you have in your community and the more support that you have as a staff member as well, I feel like the more success you're going to have overall.
I appreciate that it's everyone gets support from everyone else. It's not that you're constantly giving. And yes, that very well said, Miriam.
Jan, can you share a little bit more about your program strategies to provide support to survivors of IPV? In particular, like what are some of the federal and state monies that you're using to leverage and fund some of these services that you mentioned before?
I think the state, I do not know of more money that, and I'm thinking through this, I do not know of more money the state has received, TANF, state TANF have received to deal specifically with IPV. I do know that the domestic violence program that is in a separate area, it's in adult and family services, child and family services, applied for the CARES Act. And they did receive the $900,000 specifically to support county, local IPV programs. I do not know whether any of our counties or domestic violence programs themselves have asked for or received money. I don't know.
So we've had actually quite a few questions from the audience come in. So I want to ask you both one more question and ask you both to respond to it. And then we'll move into the audience questions. And it's really about advice. So if you could each just provide maybe your top one or two pieces of advice that you would share with TANF programs with respect to a few things. How to sort of train staff on IPV, to screen for it, and then importantly, given our focus today, how to address it, particularly during this pandemic. So screening, training, and addressing our current situation. Miriam, do you want to go first?
Sure, yeah. I know Jan mentioned in her presentation itself is like, you don't have to have the screening be like a formal sit-down interview. You can give your clients the screening tool. I think what's really challenging is applying for public benefits is not really a trauma-informed act in and of itself, but there are really trauma-informed ways that a service provider or a client administrator can interact with their client. And I feel like it's frustrating because you have to be patient, you have to be, go with the flow and just really let your client lead in terms of how you go about doing the appropriate screening. And it might mean, like Jan said, get comfortable just like putting pending for a little bit until you can find more information. And that could mean, more client contact, having more discussions about it. And something that we also heard is that survivors, even if you explain that the family violence option exists, survivors are still nervous that disclosing abuse or disclosing their history of abuse is going to jeopardize their availability to access their benefits, or might jeopardize the amount of benefits that they have, or they're going to just feel like they're being judged, like the administrator is feeling like, okay, this person's not worthy of getting money, they have so much trauma, and like, how are they ever going to sort this themselves out? In terms of services and supports, like I would just go back to that collaboration model. I think it really benefits everyone. And something that is COVID specific, which I think a lot of advocates are doing really well, it has inspired an inordinate amount of creativity in terms of how to get in touch with people. Does that mean like you're leaving someone a voicemail about a doctor's appointment that they have, and they know that that means that that's actually their TANF administrator or domestic violence advocate or something like that who's trying to get in touch with them? Does that mean that someone's asking about, their child daycare provider or things like that? So I think that the collaboration would also lead to a lot of these creative solutions being available for TANF folks to be able to use in their own advocacy, and just like also using a domestic violence advocate to help get in touch with a client or help navigate these processes and things like that. But yeah, that's my quick takeaways.
Jan?
So in terms of screening, one of the things that we have created is a little pamphlet called How to Succeed in Colorado Works. And that pamphlet we advise being provided to every customer. And in that pamphlet, it starts out, say, Colorado Works is a works program, et cetera. It has certain requirements, except if there are certain conditions. You may be excluded. You may be exempted from certain things. So if this has happened to you, then you may be, it's a soft approach. It's not, has anybody ever hit you, pushed you, shoved you, it's, here's how to succeed. Here are the requirements. Here are some exceptions. Are you in one of these categories that might be accepted? And so what we advocate is that you provide that with the customer, and you normalize things. So you put it in the packet of things you're handing out to the customer, and you say, we're going to cover your packet. Some of these things might not apply to you, and it might not apply now, but may apply later. So, but I'm required to go through them. So let's talk about childcare. Do you need any childcare? Okay. Let's talk about transportation. Oh, let's talk about what it takes to succeed in Colorado Works. Oh, you see how that just normalizes it, and people don't necessarily feel called out for domestic violence or, oh my, we're going to talk about that. It's okay. And then and part of it is child support then. And as a matter of fact, that was the suggestion from a worker several years ago that we do it like that. So since then, we have done that, and workers have reported that people are voluntarily providing that information. No, I don't want to participate with child support because X, Y, Z, and that is when it is highly likely that the survivor will provide that information to the technician because they see what's in it for me. Because if survivors don't see what's in it for them, it's all about danger, danger, danger. You're going to take my kids. I'm not going to get benefits. You're going to judge me, the things that you've been talking about. And so how do you smooth into that? And with domestic violence and screening, they answer one yes, that's it. We don't need to go through the whole screening tool. That moves into assessment. So determining the difference between screening and assessment. Once there's a yes, that's it. And there's no point in traumatizing the survivor or the secondary trauma for the worker. So it's really critical that you know what your job is and you know what you're doing when you're doing it, so that you can focus on that and then move on. Does that help with the screening? And then the training, I would just suggest that it is one of the things that and address. So one of the things that I suggest now, as we are all figuring out what's going on and how to really work with this, I suggest that the workers contact their local domestic violence program and talk with them about how they are talking with survivors on the phone and how they can inform each other about techniques, about discoveries, about what trends that they're finding. And also, even though many customers who are not survivors of domestic violence may be calling from their car or their closet or their bathroom to get away from the crying kids or the barking dog, those are thinking about what are some red flags that you might think about and in working with your clients. So I don't know if that completely answered your question, but.
So let's move on to our next slide. Great. So we have our next poll. Thank you both, by the way, again, for that rich conversation. What kind of resources, support services does your agency currently provide to participants experiencing IPV? So you can select all or any that apply. Referrals to partner organizations, domestic violence hotline, telephone number, screenings during intake, childcare, or other. Give folks a moment to fill that out. All right, why don't we pull up the results? So a significant proportion are providing referrals, as well as the DV hotline, and still a significant majority, but less so, are doing screenings and childcare. Quite a few doing other as well, which folks might have put in the chat box. Thank you. Next slide. So we've had quite a few questions come in already, and I'd encourage you again, if you have questions, to please put those in the question and answer box. The first, Miriam, came in for you. I think a few people, like you, as you were actually delivering the slides about the economic costs of IPV, were really taken aback by some of the numbers you were sharing. And so can you share what the source was, particularly for the information that you were discussing with respect to the lifetime cost of DV? Where was that data coming from?
Sure. It's actually a CDC study from CDC researchers that is called the lifetime economic cost of IPV. And I believe it's 2 years ago. But I can also certainly circulate that to the organizers, and then you can plop the link in.
Great, thank you. And there was a related question that came in about what kind of costs do those estimates include? Like what were some of the costs that were considered, if you recall, from that study?
Sure. So that was literal hospitalization costs, mental health care costs, criminal justice costs, prison costs, lost productivity costs, I believe, to some extent are included. So it's a variety of those. It's a really fascinating study. I think something similar was done probably over a decade ago, but this is more recent. And it really is staggering in terms of the estimated cost and how much it devastates the economy and how much of it is preventable.
And again, another question for Miriam. I'm going in order, so folks are asking questions during your presentation, and then in Jan. Someone asked about how a victim might be able to actually reach your organization and the assistance your organization provides. I know you had at the last slide some of your information, but maybe you could share a little bit more about what your organization does again and how victims might be able to access assistance or support.
So we are the fastest, easiest way to get in touch with us with our acronym NRCDV. So we are at nrcdv.org, and that's also all of our social media, Twitter, Instagram, Facebook, et cetera, all the same acronym. We have a chat box up top that actually allows you to email us if you have a technical assistance question. We don't provide direct services to survivors, but we got queries from survivors all the time, and we make sure to do a warm handoff to a service provider on their location or actually, get on the National Domestic Violence Hotline with them and make sure that they get to where they need to go in terms of the resources that they're trying to access. So we are a federally funded technical assistance resource center. So we're basically supposed to provide research, policy guidance, education on the variety of domestic violence issues. We have a variety of different projects. So if you're interested in prevention in particular, so primary prevention, if you want to focus on school prevention, the intricacies of the housing and homelessness system are incredibly complicated to navigate as victim advocates and for survivors. So we have an entire project on that. We have a project on runaway homeless youth, community-based participatory research. So if you just go to our website, you can see all the variety of things that we do. And the fastest way is just to email us and we can get you to the right place. But thank you for your interest in us. We are here to help you. So looking forward to connecting.
Thank you. So this next question is for Jan. Jan, you spoke a bit about a perpetrator treatment program, and there was a few questions that came in about that. So could you maybe re-explain sort of a little bit about what that program is, and then share if perpetrators are mandated by court, or like how are they participating in that treatment program or service?
So in Colorado, we have a commission that provides certification for perpetrator treatment providers, and those are the only perpetrator treatment providers who are allowed to provide treatment to court-ordered perpetrators. So there's a list of those people, and they exist in most counties. They do not, a perpetrator treatment provider may not exist in some rural counties, but they exist in most counties. So and there's a list on the state website. And what I encourage people to do is to go to that state website and Department of Justice website, look for, it's called DVOMB, Domestic Offender Management Board. Click on their county, find a certified perpetrator treatment provider, and talk with them before they meet with any clients. They should know what resources are available. Then if the client has some concerns about domestic violence, then they can contact the perpetrator treatment provider. So basically each court, each judicial district has their list of perpetrator treatment providers. And if someone is, and in Colorado, we have what's known as a sentence enhancer. So if a person is convicted of domestic violence and the underlying fact situation is, if someone is convicted of a crime and the underlying fact situation is domestic violence, the judge shall order the person to an assessment by a certified perpetrator treatment provider. And if that assessment determines that they can benefit from treatment, then the judge shall order that person into treatment. So it's a whole separate entity. So this is the collaboration. It's a whole separate entity, and I just suggest that the county workers and department collaborate with the perpetrator treatment provider in their jurisdiction in order to understand more about perpetrators and to be able to make referrals when appropriate.
So I see we have about 6 minutes left. We want to give folks a moment to complete the last poll and complete a short evaluation at the end. But I do want to ask, because there have been a few more questions that came in, so I'm going to ask you one more and just ask that you answer it briefly, even though it's a really big question. How would both of you recommend better establishing relationships between DV advocates, DV agencies, and TANF programs? Maybe if you could each provide sort of one top suggestion or tip. Miriam, do you want to go first and then Jan?
Sure. I would say I was like most of your domestic violence resource centers and most of your advocates and programs around the country are going to be very friendly and open to, like, if you cold called them and you're like, I'm the TANF administrator in your district, like, they're going to be very open to meeting with you. They're probably going to be very excited about the collaboration. So I don't really think you're going to have issues there. I think that if you have any financial capacity to compensate them for their time, that is the most valuable resource that I would say. Time is money. So I'm sure that they want to collaborate with you. I'm sure that they're going to be very open and welcome and excited about it. But if you can also compensate them for that training, I think that will go leaps and bounds and very far in terms of you establishing a strong and long-lasting relationship.
And ditto.
Well done, Jan. Well, thank you both so much again for your time. I'm going to turn things back over to James Butler from the Office of Family Assistance to close us out.
Thank you very much for inviting us.
Thank you.
Thank you so much.
I just want to express my sincere appreciation for both of you for presenting to us tonight, or today. And a special thanks to Jesse for facilitating. And most importantly, a special thanks to those of you who took time out of your schedules to join us today. As a reminder, webinar resources and speaker bios can be downloaded from the control panel on the right-hand side of your screen. And as always, a transcript and audio recording of this webinar will be available within a week or so on the PRTA Network website, and you should see that website address on the screen before you. If there's a topic you'd like to hear more about in the future, we'd like to hear from you. You can send your ideas by email to the web address that's also on the screen before you. You can also help us expand our network and reach a greater number of people by directing interested colleagues from your local, state, and tribal networks and agencies to our website, which is the prta.acf.hhs.gov. And just so that you'll know, we're going to launch a quick survey for you to complete regarding today's webinar, and that will appear in a separate pop-up window when the webinar ends. Your feedback is very important to us, and it helps us to inform our future webinars. Thanks again, everyone, for joining us, and we look forward to your participation in future webinars. Enjoy the remainder of your day and continue to remain safe.
Thank you all for joining us. Have a good day.
You too.
Bye.